longer. We stand here today to say that we want something that not only saves our budget, but saves our lives. We're here for something that shouldn't be considered a privilege, but should be a right in the greatest country on the face of the earth. And that's quality, affordable health care for each and every American. And what does that mean to me? That means that every American gets health care. That means that those who have health care get to keep it, and they don't get denied simply because an insurance company wants to deny them from critical health care. It means that we need a public option for real competition in this health care system.
I just left in that building, on the third floor of that building, I just left the health insurance markup. We just recessed for a couple hours. Let me assure you, the special interests in the health insurance industry will not hijack this process. We must have a strong public option, and we will have a strong public option. You will, all of you together, as you talk to your members of the House and your members of the Senate, all of you together will make it happen for Michelle from Willoughby, Ohio. Michelle was diagnosed with breast cancer. She had excellent coverage through her husband's insurance. He lost his job. She lost her insurance. Not yet eligible for Medicare, Michelle found an insurance plan as exorbitant as it was. With the economic downturn, she said basically all of her income goes to pay for health insurance. So as you lobby today, remind congressmen and women, remind your U.S. senators that reform is about keeping what works and fixing what's broken.
You said you've been just out of a hearing this morning, working on the healthcare reform issue. What is the prognosis? And
I think it's good. I think we're going to see a good plan. We're going to see a strong public option. We're basically going to protect what works and fix what's broken, and and we're going to. I hope we're going to do it by the end of the year. President Obama wants to sign the bill in October. I think we're on schedule.
Is this rally going to make a difference?
I think anytime large numbers of people do a rally and then the enthusiasm they bring from the rally across the street to talk to their congressmen and women, to talk to senators, to tell them how important this is to them personally as activists in Cleveland or in Toledo or in Columbus or in Akron or anywhere else in this country, that absolutely matters.
And so it's critical, you think, right now for people's voices to get heard.
Yeah, people that are watching this, that are not at the rally, call your congressman or senator on the phone. Go see them in their offices. Do a demonstration outside their offices. Whatever you got to do to get their attention to show that this matters to you personally as an activist and you're going to change the world.
Brought me here today was I'm a physician for patients who need a choice. They need a choice of quality, affordable, fair health care, and that includes a choice for public health insurance option. So I'm part of a group of thousands of doctors, including the National Physicians Alliance, including Doctors for America, who represent who are part of a coalition of 250,000 doctors and medical students nationwide that support choice for our patients. And that choice includes the choice of a public health insurance option, so that patients can stay with their doctor, they can choose a plan if they want to, and they can also choose a high-quality, affordable public health insurance option. We firmly believe that that has to be part of health reform, and we think health reform has to happen now.
Now, how often do you encounter patients who are uninsured or underinsured?
Well, me personally, I work with patients who are underinsured and uninsured by definition. So as early as 2 or 3 years ago, at the beginning of the economic downturn, my clinic, a community health center in South Los Angeles, started seeing increasing numbers of patients who had lost their jobs and therefore lost their health insurance and were turning to our safety net clinic because they had no other options. Our safety net clinic is doing its best, as safety net clinics and community health centers are doing around the country, to take care of the uninsured, but it is a crime to have a situation where folks who lose their jobs also have to worry about their health and losing health coverage. It prevents me as a doctor from taking care of my patients when they don't have access to all the specialists and the care that they deserve and they need. It prevents me from referring to care that they need. It prevents me from taking care of the patients that really, through no fault of their own, are in a situation where they have to choose between food on the table and going to the doctor.
72%. 72%. What part of 72% do you not understand?
Gotta keep the corridor clear for the meeting. Snap a picture, but I gotta keep it.
We're not asking for a specific system. We want to be able to choose. Trust the American people. For too long we've had elections, and then people go back to Washington and think, okay, the election is over, we don't have to wonder anymore. This is just the beginning. And we don't just think this is an incredible rally, but this is not good enough. Every day we're going to be on the internet. Every day we're going to be on email. Every day we're going to write our congresspeople. Every day we're going to make phone calls. This is a government that we elected for real change. We want that change now. Now,
How perilous a moment are we in terms of getting real health care reform in the Congress right now?
It all comes down to the public health insurance option. If there's an option, then that's real health insurance reform. If there isn't a public option, then you shouldn't do it because it's not insurance reform. We're wasting the money.
So, what is your sense of whether Congress is going to really listen to the voices that are here today?
I think they are listening. I think you have to understand that the Senate takes a long time to do things. They got to try a lot of things. They're unsure. They're a group that's led, not that doesn't often lead. They're led, and they're working all this stuff out. But we got to keep the pressure on here. They are going to respond to the American people, and we got to make that clear.
All right. So this rally is going to make a difference?
I think it definitely makes a difference. But the important thing about this rally is this is the beginning. From here on, we've got to keep organizing, keep the heat on. This can't just be a rally and everybody goes away. We got to keep it up.
So what kind of experience have you had working with uninsured residents?
Several levels. We're facing the same hardships in Missouri as everywhere else. You will have a mother who's trying to provide for her family, and she's trying to get into a COBRA plan where they're charging $1,200 a month, which is outrageous. It's impossible for her to survive on that. On the other level, a small business who would like to provide insurance for their workers, they can't afford it. So over and over again, it comes back to the economic impact that it's having on our communities and our state with a public option that would give small business an opportunity to take that piece of problem off the table. And these single moms and married families and everyone would have an opportunity to give people, their family members, the health care coverage that everybody deserves. We're still in 2009 talking about an issue that should have been off the table decades ago.
Right. Well, why do you think it's not?
Well, obviously the politics, and a lot of guys have been donated money by the insurance lobbyists, and insurance companies don't want to come in and do their part. And I think it's long past time that we start paying attention to that and do something about it.
We have health care.
Public option.
There are those that say, just give us a voucher. Well, would you like to vouch for a voucher? No. I say there is no option but a public option. No option but a public option. And I say to those who want to co-op, be careful you don't get co-opted. For those who say we need a trigger, I say be careful. You could be shooting down health care. We need a public option that puts the public first, and there is no option to doing that.
Veteran of these healthcare fights, how serious a situation are we in terms of getting real reform passed through the Senate?
We're in a fight, and we want that fight to end up right, which means we want comprehensive health care reform for everybody, not just the 50 million who don't have health insurance. We want good insurance for those who have it and get denied by their insurance company. We want that to end. We need a strong public plan so that we can ultimately drive down costs. If we can continue with the leadership of President Obama and keep this citizen pressure alive, we'll make it happen.
What do people need to do after this rally to keep the momentum going on this issue?
To make sure that they send letters, they make phone calls to their representatives, whether they're in the House of Representatives or whether they're in the Senate. Let your voices be heard.
I sent you 3 letters.